Hello everybody, this is a lecture on injury risk reduction in paddle sports presented by myself, Dr. Nick Anderson, PT, DPT. I went to Cleveland State University where I got my doctorate in physical therapy. I obtained my undergraduate degree from University of Buffalo in exercise science. I've been practicing physical therapy in the greater Cleveland area, specializing in sports and orthopedic physical therapy. I'm an avid skier, kayaker, soccer player, golfer. I'm also the owner of Pinpoint Physical Therapy located in Rocky River, Ohio. So this presentation is for PT students, physical therapists, and also any paddlers, kayakers, stand-up paddleboard people that wish to reduce their injury risk on the water and might want to educate others and expand their own knowledge with the following information. Here's a quick outline of what we're going to be going over. So what are paddle sports? Recreational sports involving watercraft and a single paddle or double-sided paddle in flat water or whitewater. We'll be going over mostly whitewater kayaking and sea kayaking today with the double-sided paddles that you can see the pictures on the right side of the screen. So here are a few other images of different watercraft that are available to use. Whitewater paddling involves paddling one of these watercraft down moving water. Different whitewaters classified by amount of danger and the amount of water flow. I want the students to take a look at this picture on the side of the screen and start looking at shoulder positioning, wrist positioning, what joints may be at risk here, what muscles are working in conjunction with each other. This is called a high brace. It's a very common move in whitewater kayaking especially. So just start getting an idea of some of the movements and start brainstorming on different joints that may be at risk here. Whitewater is classified 1 through 6. The higher the class, the more dangerous the river or the run is considered. Class 1 is babbling brook, little relaxing stream, up to 1, 2, 3, 4, 5, and 6 get much more dangerous as you move up that scale. Take a look at this video. This is kayak playboating. It can be very taxing on really the entire body, core, upper extremity, lower extremity. Take a quick look at this. So these are a couple typical moves that are seen in higher level whitewater kayaking. I also want to show a quick trailer for the River Runner. I'm going to skip ahead here and start getting a look at some of the movements and common patterns that might be seen in whitewater kayaking. So hopefully that gave you a good idea of what can be involved in very high level whitewater kayaking. Another typical move in whitewater kayaking is the kayak roll. If you flip over upside down, you have to be able to right yourself up. So start looking at some of the mechanics involved in a really smooth roll here in this video. Okay, so that was a very good example of a kayak roll. I'll show it again one more time, just to get a view of wrist angle, shoulders. Watch the neck and head when it comes out of the water. Very smooth and relaxed. Here's a video of stand-up paddleboard surfing. This involves a paddleboard, which is a large surfboard with a single side paddle. And then here's a picture of a lake or sea kayak, which is a bit longer than the traditional whitewater kayak would be. So the biomechanics of paddling are quite interesting. It's really a full body movement, not just upper bodies, not just shoulder, not just pulling. You really get the obliques and cores involved, along with glutes, hamstrings, quads, and when one side pulls, the other side pushes, especially in whitewater kayaking. So some of the most common injuries in paddle sports that we see: sprains and strains, dislocations, tendonitis or tendinopathies, low back pain, fractures, head injuries, cuts, lacerations, hypothermia. So we'll be going through the highlighted few here and discussing how we can hopefully reduce injury risk. Here's some general common safety tips for those that aren't into paddle sports. Wearing proper safety equipment, helmet, gloves, elbow guards can protect against impact. Weather appropriate gear. That means if it's cold out, wear the proper layering. Paddle within your skill range. When in doubt, sit it out. I think that's pretty common sense with most sports in this realm. Have some type of CPR, first aid training, and have a good group with you. Don't paddle alone, and take lessons and instruction if this is something you're interested in getting into and learning more about. That would be the safest way to go about and learning the sport properly. Here's some pictures of some safety gear. Typical here: spray skirt used that keeps you inside the boat without water getting in it. You have a good helmet there, high level life jacket. Some will have a knife and a first aid kit in their kayak as well. So here are the three most common injuries we're going to go over that are seen in paddle sports. So sprain and strain, it's a common injury to a muscle, ligament, tendon. As the PT students know, the difference between sprain, strain depends on if we're talking about ligament, muscle, or tendon. And of course, they're graded from 1 to 3, from partial injury to full tissue rupture. Both sprain and strain are generally caused by too much force being applied at a speed or angle that the body is just not ready for. You're not strong enough for it, you're not mobile enough for it, and that is when you can get some of that fraying or tearing of the ligament or of the muscle tendon complex. Here's some typical healing times that we'll see. I really like this picture by Dr. Caleb Burgess. It really goes through a nice timeline that you can use with patients. I have this saved on my phone, and it's just a nice informatic here that if a patient asks quickly on eval, what should my timeline for recovery be? Go back to this. It's a quick reference for you. So how do we reduce the risk for sprain, strain? Really, the main thing is to improve strength of muscles and tendons. Muscle strength alone, there's been plenty of research has shown to be the most important factor in reducing soft tissue injury in multiple sports across the board. And then you'd also want to improve joint mobility, improve flexibility of muscles around the joint, and then, of course, allow injuries to heal to their full extent. Dislocations, pretty common sense here. The most common two are in the glenohumeral joint in the shoulder and paddling, along with finger dislocations actually from paddles, jamming, and hitting rocks and such, in whitewater kayaking especially. These generally happen to a trauma such as a fall, direct blow to the joint. It would be one of those quick jarring type motions that you can see a subluxation or a dislocation in, especially the glenohumeral or the shoulder joint. So how can we reduce dislocation risk? This one's tough because some of the movements in these sports are very quick and can be pretty punishing. Again, I'll go back to the, let's improve strength above and below and in the joint for the muscle tendon units. Let's improve joint mobility and strength, working various angles, heights, different speeds, and working on proprioception and joint stability exercises, both reactive, dynamic, and perturbation type exercises can be very, very beneficial, especially for the glenohumeral joint, which we all know is built for mobility and less so for stability. And then with the fingers, that can be a tough one, but wearing protective gloves can protect those fingers potentially from impact and whitewater activities. So tendonitis, this is one of my favorite topics to teach about and to teach patients about. Generally, it's an overuse injury when a tendon or muscle becomes painful and inflamed. Chronic tendonitis, used to be called tendinosis, tendinopathy, can create actually some degradation of the tendon, so there would be less inflammation involved in this. The most common two areas that we see affected would be the rotator cuff, so the external rotators, or supraspinatus for the elevation, and also with the wrist extensors. You have that lateral epicondyle area that can be prone to overuse injury in paddling sports especially. So tendinopathies, let's talk about this for a second. So I like to use the teeter-totter analogy for patients when they're trying to understand what this injury is and what caused it and where can we go from here. What would the plan of care look like? So tendon muscle unit, they're pretty simple. You have a force capacity, right, on one side, and then on the other side, it's how much load are you putting into that unit. Now, if there's a mismatch between force putting into that system, then there can become some inflammatory cycle that happens, right? Some irritation, some overuse injury. Now, to calm that down, number one, let's reduce inflammation, give it some rest, some active, gentle recovery, and then it's over weeks and months rebuilding up that load tolerance capacity in that muscle tendon unit to then hopefully be stronger than it was before the injury, to go back to the previous activity, right? The previous activity will still have the same load going into that muscle tendon unit. So let's say someone's kayaking, they have a lateral epicondylitis, tendinopathy. You would want to let it calm down and then build it back up to where it's stronger than it was previously. If the patient wants to go back to paddling, the same type of classification of water that they wanted to do, that they were doing before. So overall steps to reduce injury risk. I love to create this pyramid of health for patients. So obviously the moderate aerobic activity, 150 minutes a week, and a few days of strength training per week should be at that baseline of health, along with hydration, adequate nutrition, stress management, and getting proper sleep should be that base of that pyramid. If you're not getting that correct, then you're going to be at a higher risk for injury, along with creating a longer healing time if you are already injured. A few other ways to reduce injury risk in paddling include a dynamic warm-up before paddling, cool down stretching after paddling, the strength training that we've been talking about, increasing that load capacity for the musculoskeletal system, and then endurance, mobility, flexibility training, which should also be part of the program. So a few fitness tests that I think are very applicable to those that are into paddle sports would be the sit-up test, 60 seconds, bent knees, complete as many sit-ups as possible. Here's the age-related norms here. The next one is the push-up test. It's essentially doing push-ups until failure. Here are the age-related norms for teens up to 60s for males and females. And then the next test is the step test. We use a 12-inch step, a metronome at 96 beats per minute, and a stopwatch. You step up and down for 3 minutes, and you immediately take your heart rate afterwards. And so these two charts are above male and female heart rate after that. So my first question would be for the students would be which of these tests would be appropriate for kayakers? You might choose all three. And are there any other tests that you'd want to do for general fitness with most any patient? Dynamic warm up, again, just to review, research shows that dynamic warm up is more effective compared to static stretching before activity to reduce injury risk. Should include all the major joints in the body: neck, low back, shoulders, elbows, wrists, hips, knees, ankles, and especially the upper extremity for paddling. For 5-10 minutes, make sure get a good dynamic warm up in. Make sure you educate that to patients. A few examples here for dynamic warm up could include some neck stretching, hip stretching, and we're talking dynamic stretching. Some rotator cuff band work, posterior deltoid band work, and nerve glides. I like the median nerve glide, standing for the shoulder, wrist, and elbow. So another few specific warm-up exercises: band pull-aparts, external rotations. So we're really getting at all those major areas and all those major joints that we touched on before, along with adding some full body jumping jacks, squats, anything like that to get the heart rate up. And some cool down exercises, pretty basic: neck stretching, levator, upper trap, low back stretching. It's a lot of sitting and kayaking, so make sure you get those extensions in. And then some upper extremity, lower extremity stretching, hamstrings, quads, cross body, sleeper, tricep stretching, anything like that would be wonderful for our cool down. Here's a few more ideas for cool down exercises. So recovery from injury. Obviously, injuries cannot be prevented, but we can try to reduce the risk. So how do we know when someone is safe to return to paddling? Well, hopefully consulting a skilled physical therapy would be the first thing. Skilled physical therapist would be the first thing on their mind. It can help create a graded return to paddling program based on the severity of their injury. So here's a nice progression that I like to educate with really any return to sport after might be a surgery, it might be an acute injury, but the first thing is to calm down pain, calm down inflammation, right? Modulate that central nervous system, the peripheral nervous system. Let's get this thing calmed down, and then we got to start gradually building strength over time. Now, this might be a surgical protocol for, let's say, a rotator cuff repair. This could be adding gentle isometrics in over time and working in through different range of motion exercises. But we want to build that strength first, along with that mobility. From there, you want to build stability, and with that stability and proprioceptive exercises will come that confidence. This is the fun, creative part of recovery. A lot of options here between open and closed chain exercises. Paddle-like exercises, so have them bring a paddle in, have them sit, weight it up, add some perturbations, see how it goes. So that would be another example of progressing that dynamic stability, reactive stability. And then have them go paddle around on some flat water. It might be in a pool, it might be on a calm pond, a calm lake. See how it goes, and then from there, introducing just maybe a local paddle on some turbulent lake, or some class 1-2 paddling, and then eventually return to full paddling, return to play. So I want to touch on this slide in detail here. So this is general. It might even look like a post-op protocol here. So you want to retain the full range of motion and effective joints. Passive range of motion first, active assist range of motion, and then that active range of motion, along with regaining full strength and the effective joints. Now, manual muscle testing does have its limitations, even if you are using a force meter. So a few tests I put in here that I really do think are pretty useful for any upper extremity athlete would be the closed chain kinetic upper extremity test and the push-up test, along with self-reported confidence scale, and of course everyone loves the DASH questionnaire. So the closed chain upper extremity test, you can see you put 36 inches apart. You're going to a high plank position and you tap the hands back and forth for three trials. And here are the norms. That should be the goal for males and females. So return to water. Once functional testing is passed, it's time to trial that paddling. Like I said, on the flat water, then move it to moving water, increase into turbulent water as tolerated, and increase that class of water over time as you become more confident and as that patient becomes stronger. So here's one case study for the students. Patient is a 65-year-old male who just returned from a week-long kayaking camping trip. He paddled mostly class 1 to 2 rivers for 5 miles daily. This is much more mileage than he is used to. He is generally physically active with no core or morbid factors. He comes to PT complaining of sharp right elbow pain, which got worse with paddling. Ice did help once we got him home from his trip. He does notice gripping paddling is painful. No other complaints of pain in neck or shoulder, hand. His goal is to paddle the rest of the summer casually with no pain or less pain. So my question would be, what other questions might you ask this patient about his history or current injury? What differential diagnosis options are there? How would you rule them in or out? What factors are to consider when developing his plan of care and programming? So I want you to pause the video right now, take a second, write down some answers here. So a few other questions you might want to ask this patient, is there a recurrent history with this? Is this the first time they've had this injury? Make sure you're ruling out and making positive there is no radicular symptoms. And also asking on the other side, how is the left side doing? Any history of the left side? Differential diagnosis, immediately I go to lateral epicondylitis, possibly a radiculopathy. So how would you rule them in or out? Do your cervical test cluster, make sure we're ruling out any type of nerve issue, any type of nerve entrapment with peripheral innervation. And then, of course, you can do the testing for lateral epicondylitis. Other factors considered when developing his plan of care. So he seems more of a casual paddler, right? Wants to paddle casually for the rest of summer. 65, do class 1 or 2 rapids. He's going to need probably a good strength and conditioning program. You'd want to do some baseline testing for general conditioning, general endurance and strength. And get him on a strength program if he's not on one, a few days a week, along with some endurance programming. So case study 2, it's a 30-year-old female. She's a pretty high-level class 3 and over whitewater kayaker. On a recent trip 2 days ago, she injured her right shoulder. When her paddle hit a rock abruptly, she rolled over and tweaked her neck after she rolled back up. Her shoulder is painful to elevate and feels weak to move. She has no symptoms in the neck, but does report intermittent numbness in the right lateral elbow area. Grip strength seems fine. Her goal is to return to high-level kayaking, whitewater kayaking, as soon as possible. So what are some other questions you might ask this patient? What differential diagnosis options are there? What tests would you rule in or out? And how might you plan that plan of care, home exercise programming, and how would this differ from the previous patient? So I'll have you pause this and write down some answers. So immediately I would ask this patient more about the method of injury and if there are any other symptoms going on as far as shoulder instability, feelings of clicking, locking, catching in the shoulder. A labral issue goes to my head. I would also ask, hey, did you hit your head? Was there any head injury involved? Try to rule out concussion. Differential diagnosis. Immediately I'm going to possibly rotator cuff injury, possible labral injury, possible radiculopathy, radicular symptoms coming from possibly cervical spine or somewhere down the chain. So what test to rule these in or out? Again, do the cervical cluster, try to rule in or out cervical radicular symptoms, along with peripheral nerve testing. You could also do the rotator cuff cluster and the labral cluster, which kind of go hand in hand together. The testing isn't perfect for either of those injuries. Plan of care programming different compared to the previous patient. Now, this is could be a longer recovery potentially for this patient. She is younger, but again, she wants to paddle and kayak higher level difficulty, more dangerous water. So you really want to get a game plan down for high level dynamic and reactive stability, high level strength programming. We're talking barbell pressing, rowing, dumbbell pressing, rowing, along with some of that proprioceptive open and closed chain exercises as well. So compared to the previous patient, this patient may just need higher level care, maybe more creative care, especially if you're not super familiar with kayaking as a whole. So that's going to conclude the presentation. Again, my name is Dr. Nick Anderson. I hope you enjoyed the lecture, and I wish all the students best of luck in the program going forward. Thank you.